Okay, so let's talk about bunions. So, what is a bunion? So a bunion really it's that bump you see on your big toe on the inside part of it. That's a bunion by definition. A hallux valgus deformity, hallux is actually the big toe. So a hallux valgus deformity is actually the angle that you see where your big toe is starting to deviate to the outside of your foot. So that's a hallux valgus deformity. But either way, we'll just talk about bunions. And so bunions are a big problem, and we see a lot of bunions. And so, what do you do about them? Is there any non-operative treatment for this? What's the operative intervention? What's the course of treatment, surgical? So non-operative treatment, why do you get bunions? And so the majority of reason why people get bunions is there's a genetic component to it. So either their mother, even their father, males get bunions too. So typically a grandmother or a mom gets a bunion. We do almost 3 to 4 female bunions to 1 male. So it's predominantly a female issue, but again, we do see males. So there's a genetic component to it. Shoe wear, so wearing extremely high heels or pointed shoes tends to jam the toes in the shoe, and that causes the big toe to move over to the outside as well. So shoe wear can be an issue. Some people have what's called ligamentous laxity, meaning that just the collagen or the soft tissue in their joints is very loose. And so you put your elbow out and their elbows bend backwards, they can take their thumb and kind of touch their wrist. That's ligamentous laxity. Well, that also affects the toes, and so their toe is hypermobile, so it begins to move, and it typically moves in a bunion type direction. So those are sort of the people that get this. And so from a non-operative standpoint, obviously wider shoes, but very hard to convince someone who's professional who wears high heels to wear wide shoes. So wide shoes, there's little bunion splints, and so they're not going to fix the problem. They'll help alleviate the symptoms, which is pain. And so a little toe spacer will help straighten the toe while you're in a shoe and take pressure off the joint and the joint capsule that's actually being stretched and being pulled over. So, and there's night splints you can wear at night, but they can be somewhat tedious, and patients typically don't like wearing a night splint every night, even though it's not going to fix the problem. It just kind of slows the progression of it. So what are indications to have surgery? So typically it's pain. You have to come in with pain. Progressive deformity, that means the big toe is continuing to shift. And the issue with that is as the big toe shifts over, the second toe has to do something, so the second toe typically comes up and you get a crossover. Now the second toe is sitting on top of the first toe. It's kind of like going to the mall. You're looking for a parking spot and someone parks over the line and it messes up the whole line. It's the same issue. So the big toe moves over, second toe's got to go somewhere, so it moves up and causes a crossover, and that's a problem. So that's indication. So pain, progressive deformity, and difficulty with shoe wear. Those are sort of what we look at. If you come in and people say, I just don't like the way my toe looks, that's not a good indication to operate. And so if you got those 3 issues, so how do you fix bunions? And so there's thousands of ways to fix bunions, and I'd say every surgeon kind of has their own way of doing it. We use certain parameters with x-ray, and also the angle, how big the deformity also determines what we do. So I typically do 2 different types of procedures. Number 1 is something called a chevron osteotomy, where we actually shave the medial. Everyone just thinks of bunion surgery is just shaving that bone. That's part of it. You can also sort of cut that bone, and we end up sliding that metatarsal head over a little bit and placing I use a pin. Some people use screws or plates. I use a pin. We actually pull that pin 6 weeks after surgery. So at the end of the day, you're typically left with no hardware in your foot, which is, I think, very, very nice. One of the nice things about the way we do bunions is we allow you to walk on your foot the next day after surgery. We put a special splint that we make that you can walk on your heel. So that's a huge thing for patients, because most people keep you off it for 6 to 8 weeks. You can't put any weight down, which is a problem. And so you're allowed to walk on your heel for one of the simple ways we do bunions. Now, if you have a very severe bunion where that metatarsal bump is huge and the toe is way over, we may do something called a lapidus procedure, where we have to fuse one of the joints in your midfoot and correct the alignment of that bone, which is a much bigger surgery. I would say we do about maybe 10 simple bunion surgeries to one of those complex ones. So generally speaking, we don't have to do a lot of those more demanding and more trying surgeries for yourself. If we do that, though, you have to be off that foot for about 6 weeks. So generally speaking, you can walk on it the next day. For the more severe and rare ones, you have to be off for 6 weeks. Either way, we see you every 2 weeks. We change your splint out. And if you're walking on it, we change it out every 2 weeks. And at 6 weeks, we pull the pin. Then you start doing some physical therapy after that. But it's a 3 to 4 month process till you're in a shoe and you're not really thinking about your toe at all. But anyway, again, many ways to fix a bunion. That's how we've done it. We're very good at it, and we've had great success with it. And I hope that gives you some understanding of how bunions, what they are, and how we fix them.